Hey everyone, and I want to welcome everyone to another update. Good afternoon. It's February 18th, 2021. I'm going to be joined today by our health director, Kelly Colopy, who will be giving us a good health overview, but also I'm really happy to also be joined today by Dr. Jill Baker, who is the superintendent for Long Beach Unified Schools. Of course, Long Beach Unified is a really incredible and important partner, of course, here at the city, and really just so critical for us as we move forward, ensuring that people are safe, that teachers are safe, that our students are learning. And she's going to come today to talk to us about what our school campus reopening plan looks like. It was just announced last night to her board, and so she's going to be able to give us an update and also answer a few questions. So I want to thank her also for joining us. I want to just begin by giving a little bit of a brief update of where we are. And then we're going to talk a little bit about schools. So first, we have now administered almost 80,000 vaccines. And to give you an idea of that operation, we are, of course, vaccinating thousands daily at the convention center. We have a clinic happening at the Long Beach Health Department. We have vaccinations happening at Cal State Long Beach. We have mobile clinics that are going into neighborhoods. For example, we have one happening just, I believe, today. We have a couple happening this weekend. These are going into neighborhoods that are maybe hard to reach, that don't have access to computers. All of those clinics are happening consistently. And then we have clinics that our partners are also running with vaccine that we've provided them, whether it's Memorial Healthcare and their clinic. There are some pharmacies in the city of Long Beach that we've partnered with as well. And the federal government has also provided direct allocation to many more partners, including some of the pharmacies like CVS and others. So we have a full-scale vaccination operation happening in the city of Long Beach, and the more vaccines that come in, the more we will do. Want to also share how much progress we've made from a COVID-19 perspective. Just a month ago, we were at a high of reporting 590 cases on a day. Now that average today is 68 cases per day. A month ago, we had reported a high of over 17% positivity rate. Today, we're at 6.9% in positivity rate. And hospitalizations are down about 36% from when they were at their highest. So that's all really great data and really points to the progress that we are making. Now, we should also note that COVID-19 remains serious, and it's an issue that is the biggest factor in our loss of life as a community. We're almost at 800 Long Beach residents that we have lost. We're at 797 as of today. And our hearts and prayers go out to every single family that has lost someone due to COVID-19. But cases are dropping, and I want to show everyone this very first graph that we have coming up. As you can see by this graphic, this shows cases since we had our first one back in March, almost basically a year ago as we are today. Now, if you look at the last surge, we peaked at nearly 1,200 cases in a single day, and if you look at that bell curve, you really see the progress that we are beginning to make. Now, by contrast, as of today, we're seeing an average of 68 new cases a day, which is, of course, just in the last 18 days, a 71% decrease. Why is this happening? It's happening because we're wearing face coverings, we're practicing physical distancing, we're following health orders. We restricted, of course, and in some ways, activities that were outside and gatherings. And we also know that our vaccination program in the city is saving lives and playing a critical role in keeping these rates down. This next graph shows you also a little bit about our hospitalizations. As COVID-19 rates have decreased, so have hospitalizations. In this slide, the blue line represents the number of Long Beach residents hospitalized for COVID-19, and the orange represents patients in our area hospitals. As you can see again, you look at that last surge in the bell curve, the numbers are going absolutely in the right direction. You can remember our ICU capacity was at almost 0%. We were at a high just a month ago, and we've made really great progress. Now, this doesn't mean that hospitalizations have decreased even beyond our summer surge that we had now many months ago, but they're going in the right direction, and we can expect that to continue. I want to now just turn a little bit about what we're doing around vaccinations. Let me begin by saying that Long Beach has taken an aggressive approach since day one on vaccinating everyone in the tier. We made the decision early on of not just vaccinating healthcare workers and seniors, but we also began vaccinating grocery and food workers, emergency personnel like police and firefighters, and of course, teachers and educators from across all of our institutions. Not just at Long Beach Unified, which we'll talk about in a minute, but also at Cal State Long Beach, at Long Beach City College, and many of our independent and parochial schools all across the city of Long Beach. And we have focused on equity, making sure that our vaccination program reaches folks where they need to get the vaccine. I want to also note that as it relates to data around school reopenings, these decisions are made by the school district. And the school district working with our county health department and looking at the data, because the data is what's driving the decisions, that's how these decisions are made. Now, LA County just recently reached the threshold for actually allowing the reopening of elementary classrooms for in-person learning. Elementary schools right now are what's allowed for reopening per the LA County data. And schools now are allowed to open grades K through 6 if they are in the purple tier and have an adjusted case rate of 25 per 100,000. And we've been talking a lot about this, of course, over the course of the last few weeks. And so our health department has been working closely with all of our school systems, but especially our public school system, Long Beach Unified, to ensure that we provide the necessary vaccine to make this happen. Now, while the city has no ability to operate or manage schools, it's completely done by the school district. What we do have some control over is the vaccination process. And that's where the school district and the city have been incredible partners. I told Dr. Baker from day one that we were going to get teachers and staff vaccinated. If you can believe it, as of today, we're probably now almost reaching 7,000 educators from all systems and all schools that have had access to that first dose, and many are about to get their second dose as far as educators across all of our systems. And so my position has always been that teachers and educators deserve to feel safe. They deserve to be vaccinated and to have a safe reopening plan that has to be a part of this reopening process. I want to now turn this over here to Jill Baker, Dr. Baker, who of course leads the Long Beach Unified School District. I will note as I turn this over that by the end of today, we will have administered the first dose of the vaccine to all K through 5 teachers and staff that have opted to get the vaccine, which of course is a vast majority. And so with that, let me turn this over to her, who's going to kind of give us an overview of where schools are at, and then we'll turn this over to Kelly Colopy as well. And so I want to welcome Dr. Baker, and she will give us an update here.
Good afternoon to the community, and I want to start just by thanking Mayor Garcia and our Board of Education. Without the leadership of Mayor Garcia, we would not be at this point in our plan to reopen schools. And also just want to acknowledge our incredible Board of Education, who for every moment along the way during this pandemic have been leaders, have helped us to formulate a plan, have asked good questions, and have helped us to get to this place where after 11 months of almost exclusively distance learning, we are thinking about reopening schools, and we are pleased to do that. So today I'm going to provide a little information about each level that has been discussed in our reopening plan with some dates in mind that the community can rely on. This information is also going out to our stakeholders in the school district this afternoon as we are here. So I'd like to start with early grades. Our TK through 5th grade students will be returning to school on March 29th, those who opt to come in for in-person learning. This date will be preceded by teachers returning to their school buildings to acclimate to all the health and safety protocols, to get their classrooms ready to communicate any of the needs that they have for their classroom before students return on the 29th. That is new information to us in terms of meeting the adjusted case rate this week, but we have been planning since last spring to bring students back. We couldn't do that if all of our educators at TK through 5 had not had the opportunity to be vaccinated and will have their second doses before students return in March, and we are grateful to the city for that effort. So our middle and high schools are held to a different tier. They need to be in the red tier to return. So we have produced some tentative dates that we'd like for them to return, but that is dependent on reaching the red tier. So our grade 12 students are seniors who have been out of school since they were juniors last year, are scheduled, assuming that we meet the red tier, to return to their campuses on April 19th. Their teachers will also come back. Middle and high school teachers will come back the week before to prepare their classrooms and to get ready for students to return. Grades 6 through 8 on April 20th. That's actually a Tuesday because the Monday is a scheduled asynchronous day in our middle school program. And then April 26th is our plan for grades 9 through 11 students to return, assuming that we get into the red tier between now and then. I want to share a few of the additional health and safety enhancements that will take place in the hybrid learning setting. So a hybrid learning setting means that students spend part of their time at school and part of their time continuing their learning at home. When they are on campus, we have several different additional safety precautions that have been put in place that we want the community to know. Students who return to in-person learning will go through a daily health screening process, the same as school staff. And for staff that are working on our campuses, they already go through that health screening process. Students will be required to wear a face covering, and students' desks will be 6 feet apart from one another. Each of our facilities, down to every classroom, has a maximum occupancy statement in the classroom that is being used to determine how many students and adults can be in an individual classroom. Elementary students will stay in their cohort. That's their own group of students and staff while they're on campus, and that minimizes the interactions that staff and students have with others. One of the questions that has been asked is about 6th grade. So in Long Beach Unified, 6th grade students attend on a middle school or a K-8 campus. And because they move in a course, in a secondary course sequence like high school students do, they are not included in our reopening of elementary schools. They will come back when our middle school and high school students come back. And lastly, we have a plan for COVID testing of both staff and students. What that looks like, it is not required by the state or by the California Department of Public Health for us to have asymptomatic testing, but as an additional health and safety precaution, especially when we're in the purple tier and returning students to our elementary campuses, we will utilize asymptomatic testing in the form of anterior nasal swab that in many cases can be administered to adults by themselves and by children by themselves. We will have additional staff that will help with that process for those who can't administer it themselves. And so with these health and safety precautions in place, with all of the protocols that we have developed to bring our students back safely, we look forward to beginning that process on March 29th with our TK through 5th grade students. I think it's important to note that families are making a choice. They have the choice this year to stay in a distance learning setting with their teacher and with their courses, or to have their students return for in-person learning, and that choice is important to our families. Right now, our data is trending around a 50% want to return in person and around 50% want to stay in distance learning, and we'll see how that transpires in the next couple of months, but we certainly look forward to March 29th. I want to point to a couple of resources that are available on our district website. So in 3 languages, in Khmer, in Spanish, and in English, is our revised COVID-19 pandemic school opening and safety plan. Many of the protocols that I've just described are here. In addition, the presentation that we made to our Board of Education last evening is on our coronavirus website page and is a good resource for community members who are wanting to know more about the plans and the dates in a written format. And so this concludes just my update, and I think I have a couple of questions. You want me to? Okay. Okay, and I'm turning over to Kelly Colopy. Thank you.
Sorry about that. Okay, so what I wanted to show, the case rates need to catch up. So right now our case rates are at approximately 20 per 100,000, and they need to reach below 7 per 100,000. So our cases are going down for sure. They've gone down substantially over the last month, and so we just need to continue to really keep our distances, wear our face masks, and do everything so that we can move further down to get to the red tier. So 7 per 100,000 is the number that we're focusing on for that space. So with that, I wanted to just share a little bit more about our vaccines so far. So as the mayor mentioned, we've administered more than 79,000 vaccine doses in the city of Long Beach. This includes people who live and work in the city. Of these, more than 55,000 were first doses, and the remaining 24,000 are second doses. We've continued to prioritize second doses through February, but also continue to actively pull from VaxLB to schedule first appointments for healthcare workers, our older adults, educators, and food sector employees with available vaccine. This week, we will continue to contact people for their second doses as well. If you were first vaccinated in January, you should have received an email to schedule your second dose appointment. If you haven't received that email, please contact the Long Beach Health Department. The email is the COVID-19 vaccine@longbeach.gov, and we'll work to get you scheduled. And if you don't have email, please feel free to call us at 562-570-4636, and we'll work to get you in. If you were first vaccinated in February, please continue to wait for an email from the health department with your opportunity for the appointment. You don't need to call us to check on the status. We have your information, and we'll be reaching out to you. In terms of, you've been hearing about the storms on the East Coast. So due to this severe storms, vaccine manufacturers have delayed shipping of vaccine until further notice. This could affect our supply here in Long Beach. We continue to vaccinate as many people as our supply allows. We have not canceled vaccine appointments to date based on that. We have sufficient capacity. You might have seen that some of the vaccine clinics in other jurisdictions have shut down, but for now we have not. We are hopeful that the shipments will be back in place by next week, and we're paying a lot of attention to that. Wanted to share a little bit more about the vaccine equity efforts. We are committed as a city to ensure our vaccines are given equitably. We can continue to provide mobile vaccine clinics for people in communities that have the most impacted by COVID-19 and those in historically underserved neighborhoods. The city recently held clinics for Spanish speakers and Black adults 65 and over. This was within the past week, and we've scheduled 2 more clinics in the next week for our Cambodian and our Latinx communities. We do appreciate all of the community-based organizations who are partnering with us to plan these clinics and connect with our communities who may have limited access to the technology or other supports to register for vaccine appointments. And they're also assisting on-site with community-based vaccine clinics. These partnerships are so important to our effort to be able to ensure that people throughout our city have equitable access to vaccine opportunities. So with that, I just want to remind everybody the numbers are going down. It feels easy to start to sort of back off a little bit, but the pandemic is not over. And so we want to make, we have a lot of hope because with the numbers as they decline and also as we move forward with our vaccine process, but it is essential that we continue to follow all the distancing practices. Even if you have been vaccinated, it's essential that you continue to follow these distancing practices, as the data don't show at this point that you're still not able to transmit the virus. So we want to make sure that everybody continues to really pay attention. We're turning the corner and we're getting through this together. I want to thank all of you for doing your part to keep yourself safe, keep each other safe, so that we can get back to the world as we want to be living in it and engage throughout all of Long Beach with our friends and family and with our restaurants and with our schools. So with that, I'm going to turn it back to the mayor. Thank you.
Thank you. And I think we have some press questions. And after the questions, we'll of course do our Spanish translation as well. So.
Yes, thank you. We will now take questions from the media. As a reminder, there's time for one question per outlet or per reporter, and additional media questions can be sent to the Long Beach Joint Information Center. Our first question is from Melissa Evans at the Long Beach Post, and it's directed to Mayor Garcia.
Hi, thanks for taking our question. I just had a follow-up on the teacher vaccinations. So the county gave a detailed presentation this week showing that outbreaks in schools are extremely rare, and the CDC has said vaccination shouldn't be a requirement for schools to reopen. I'm just wondering, with the shortage of supply, if the science says it's safe for teachers and staff to return without the vaccination, why is the city prioritizing thousands of teachers when I know we're hearing there's still a lot of seniors that can't get appointments, again, because of the limited supply?
Sure. Let me just share with that. I think first it's important to note that the state actually classifies teachers in the same exact category as it classifies 65-plus seniors. And so the state does not classify one group above the other. That's available on the state website, nor does it classify food or grocery workers higher than those categories. They're all categorized together. Then each health jurisdiction, of course, is making different policy decisions about how they choose to vaccinate. My perspective on this is as a former teacher myself. And as a former teacher, I can tell you that if we're going to expect teachers to be back in the classroom and feel safe and expect their families to feel safe and for parents to feel safe sending their kids into a classroom, I strongly believe that teachers and staff at schools should be vaccinated. And remember, the CDC recommendation as the states, like every single medical guidance, you can go safer than what they recommend. You don't want to go less safe, but the CDC also recommends that health jurisdictions have the ability to add additional safety precautions to what they're being presented. So they present those as a baseline, but then encourage health jurisdictions to take on programs that work for their own local community. Long Beach is a place that has a history of a strong partnership between its city and its educational institutions. As a city, we strongly believe that educators and those that are on campus deserve the ability to be vaccinated before campuses reopen, which is why we provided those through the state, through the tier system that the state provided.
Thank you. Our next question is from Ted Chen of NBC. It's also for the mayor.
Hi, thank you. My question is related to the last one. I am wondering, given the limited supply, how you are able to prioritize both the teachers and the seniors and the most vulnerable all at the same time when so many other jurisdictions have been struggling to do so.
I think we made a decision early on. I think it's important to remember there's a misnomer by some that teachers or food workers are somehow in a different tier or category than senior 65 plus. The vast majority of the vaccines that we give out are to senior 65 plus. That is what we're doing every single day, and it's actually the most important group when you're looking at those that are at risk. We do that every day, and it's critical. But the state also encourages within its tier to vaccinate food and grocery workers and teachers. So we're moving forward. And in fact, I think if you were to ask, the governor or the state, they have encouraged our model in Long Beach. In fact, they have told me personally that they think our model is probably one of the best in the entire state. And you're now starting to see announcements from other health jurisdictions that are now beginning to vaccinate teachers and educators. That's a decision that we made weeks ago. We think it was a wise one. But we're vaccinating as many people as we are is because we're moving quickly and fast. And we have good partnerships with pharmacies that are receiving doses from federal partners. So it's coming in from different places. And we feel good about the progress. We'd love more vaccine. We'd love to have many more doses, and we'd do more if we could. But with what we've received, we think we're on a good track so far.
Thank you. Our next question is for Dr. Baker. Okay, this question is from Julie Sohn of KABC. Will asymptomatic testing be required for students, and how often will this happen?
So the California Department of Public Health does not require asymptomatic testing for the reopening of schools, but as we return students to elementary schools and grades TK through 5 on March 29th, while we are still in the purple tier, we will be adding asymptomatic testing as an additional health and safety precaution. And so we plan to keep the cadence that is recommended, which is once a week, staff and student testing while we're in the purple tier. If it proves to be a positive mitigating factor, then we will look at maintaining that testing as long as we need to. But it is not a requirement. It's something that we're adding on behalf of our students and staff to increase health and safety precautions.
Thank you. The next question is from Hunter Lee from Southern California News Group and the Press Telegram. Why isn't the district including 6th graders in the elementary school reopening?
So in Long Beach Unified, 6th graders attend in a middle school program, either in a traditional 6th through 8th grade school or in a K-8 school. But in essence, they move classrooms through all of their coursework rather than staying in the self-contained setting that TK through 5 students stay in. In some districts across the state, 6th graders do operate on an elementary campus in a self-contained setting, but for us, they don't. And so to maintain that cohort of students and adults, our 6th graders will not return until our middle schools are in the red tier and able to return.
Thank you. Also from the Press Telegram, Haley Mungia asks, Dr. Brown said during last night's board meeting that screening won't be a requirement. Can you clarify what that means, and will LBUSD conduct screenings but give parents the option of opting out?
Okay, so this is somewhat of a repeat of the first question. So last night it was stated that the California Department of Public Health does not require us to have asymptomatic testing, but we are requiring our students and staff who return to participate in asymptomatic testing absolutely when we're in the purple tier, returning TK through 5th grade students starting on March 29th, and then we'll determine the continued need if we enter the red tier.
Okay, and finally, from Damian Calhoun of Southern California News Group, what will the district do about teachers who may not feel comfortable returning to campus, but also don't want to or can't be vaccinated?
Sure. Well, along with the city's efforts, we are highly encouraging all of our educators to take advantage of the opportunity to get the vaccine. We know that that's good for our schools. It's also good for public health. And so we have increased our efforts to make our staff feel comfortable and to utilize the appointments that have been provided for us with the City of Long Beach. But it is a choice. It is not a requirement for teachers to be vaccinated or staff to be vaccinated to be at work. In fact, we've had thousands of employees at work prior to the vaccine even being available to them. So if a staff member, if a teacher decides that they don't want to be vaccinated, they participate in a process with Human Resource Services, either to look at what an accommodation may be or to explore leaves of absence until they feel that it's safe for them on a personal level to return to work in our district.
Thank you. Our final question is for Kelly Colopy. And Kelly, this question comes from Kelly Puente of the Long Beach Post. Los Angeles is pausing vaccination efforts for Friday because it seems winter storms throughout the county are causing delays for the vaccine supply line. Will Long Beach also pause vaccinations? And if so, what should the public do if they have appointments scheduled?
So at this time, we have sufficient, we are not canceling any appointments. We have sufficient vaccine through Saturday. And then, we are also working to ensure that everybody next week who has appointments scheduled for next week has access to those appointments as well. So at this time, we are not having to pause any of our second vaccine efforts.
Okay, that concludes questions, and we will now move on to Spanish interpretation.
Muy buenas tardes, gracias por acompañarnos. Hoy es nuestro comunicado de prensa para el 18 de febrero de 2021. Hoy nos acompañó el alcalde Robert García, Kelly Colopy, que es nuestra directora de Salud y Servicios Humanos de la ciudad, así como la doctora Jill Baker, superintendente del Distrito Escolar Unificado aquí en la ciudad de Long Beach. Hoy les tendré los datos que permiten la reapertura de escuelas, el plan de la reapertura del Distrito distrito y la vacunación de nuestros maestros. También Kelly Colopy nos ofreció una actualización sobre el lanzamiento de nuestras vacunas y habló sobre el suministro que ha sido afectado por el clima en la costa este. Esto todo un poco más adelante. Ahora vamos a empezar con información general. Hasta la fecha, 50,662 residentes de la ciudad de Long Beach han dado positivos por COVID-19 y tristemente hemos perdido a 797 residentes de la ciudad, casi 800 personas que hemos perdido aquí en la ciudad. Un poco de buenas noticias, ha estado bajando la tasa de positividad, ahorita está al 6.9% y los casos por día han bajado a 68 casos por día. Hospitalizaciones también ha bajado un 36% desde diciembre-enero, cuando fue los máximos números que estábamos viendo durante toda esta pandemia. Después de este devastador aumento de casos, hospitalizaciones y muertes de este diciembre y enero, hemos comenzado a al fin recuperarnos y nuestras cifras parecen prometedoras. La primera imagen que se mostró enseña los casos que hemos tenido desde el marzo pasado, marzo del 2020. Por el contrario, al día de hoy estamos viendo un promedio de 68 casos nuevos por día, a comparación de un máximo de 1,200 casos por día reportados en un solo día. Y hemos visto una disminución de 71% de casos en los últimos 18 días. Si continuamos usando esas cubiertas faciales y practicando el distanciamiento físico, siguiendo esa orden de salud, vamos a poder seguir reduciendo estas tasas. A medida que las tasas de COVID-19 han disminuido, también lo han hecho las hospitalizaciones, que fue la siguiente imagen que fue mostrada. Es importante realizar un seguimiento de dónde estamos con las hospitalizaciones, porque debemos asegurarnos de que haya suficientes camillas para pacientes y personal médico para poder tratar esas camillas que necesitan una doctora o un enfermero, ya que sean hospitalizados de COVID-19 o por otra enfermedad. El mes pasado las hospitalizaciones fueron muy altas y nuestra capacidad en las unidades de cuidados intensivos era cero en algunos lugares o casi cero en la mayoría. Las hospitalizaciones aún no han disminuido a los niveles que teníamos antes de este aumento, pero las cifras van en la dirección correcta. Nuestra capacidad de unidades de cuidados intensivos es ahora de un 15%, que es mucho mejor que cero o casi cero en lo que estábamos en casi todos los hospitales. Esta semana el condado de Los Ángeles alcanzó un nivel que permite la reapertura de las clases en persona de primaria, viene siendo de kinder a quinto, o más bien el TK, que viene siendo el kinder en transición hasta quinto grado. En enero el Departamento de Salud Pública de California publicó una guía actualizada para la reapertura de las escuelas primarias, y las escuelas pueden abrir los grados K a sexto si están en el nivel morado y tienen una tasa de casos ajustada de 5 por 100,000. Ahora, aunque el estado dice K a sexto grado, aquí en el distrito escolar de Long Beach va a ser de K a quinto grado, y la razón por eso es que los estudiantes de sexto grado no se mantienen en solo una clase para su aprendizaje, se mueven de clase a clase dependiendo de qué están aprendiendo o qué clase están tomando. La decisión de reabrir, queremos informar a todos nuestros residentes, es solo del distrito escolar en colaboración con el Departamento de Salud. La ciudad no puede determinar cuándo se vaya a abrir o cerrar una escuela. Lo que sí puede hacer la ciudad es asistir en la reapertura con las vacunas, que es lo que hemos estado haciendo. El condado cumplió con esa métrica la semana pasada para poder hacer la reapertura de las escuelas primarias. La tasa de casos ajustada del condado de Los Ángeles es de 20 por cada 100,000 y la tasa de casos de la ciudad es de 23.2 por cada 100,000. Nuestro departamento de salud ha estado trabajando en estrecha colaboración con el distrito escolar y las escuelas locales a medida que crean planes de seguridad para poder darle la bienvenida a todos nuestros estudiantes de una manera segura. Ahora, hemos hablado también de esa relación que hemos tenido con el distrito para poder ofrecer vacunas a nuestros educadores. Hemos trabajado para vacunar a todos nuestros educadores en nuestra ciudad y hasta la fecha hemos dado 2,000 citas a la Universidad de Long Beach. 500 citas para el colegio Long Beach City College, el colegio aquí de la ciudad de Long Beach, y 1,200 citas en escuelas privadas y guarderías, y también 3,300 citas para el distrito escolar de Long Beach, LBUSD, porque claro que ellos son el mayor proveedor de educación de la ciudad para los niños de nuestra ciudad. Empezamos la primera dosis para los maestros y personal del distrito escolar la semana del 25 de enero y continuamos haciéndolo hasta el día de hoy. Anticipamos que todas las segundas dosis se administrarán a el distrito escolar antes del 15 de marzo. Más de 1,200 miembros del personal del distrito están programados para la segunda dosis dentro de la próxima semana. Esto significa que antes de que se establezcan la reapertura de escuelas, todos los maestros y el personal de kinder o de transición de TK a quinto grado que han elegido recibir la vacuna estarán completamente vacunados. Ahora vamos a hablar más sobre el proceso de reapertura de las escuelas, lo cual presentó la doctora Jill Baker, superintendente del distrito escolar de Long Beach. La reapertura por etapas del aprendizaje en persona está planificada para empezar el 29 de marzo, después de más de un año de aprendizaje principalmente a distancia debido a la pandemia mundial de COVID-19. Nos complace anunciar que el Distrito Escolar Unificado de Long Beach planea comenzar el regreso gradual de los estudiantes a clase el 29 de marzo. Los estudiantes que regresan el 29 de marzo serán aquellos desde el kinder de transición, TK, hasta el quinto grado, cuyas familias hayan seleccionado el horario híbrido, que significa parte del día en la escuela y parte del aprendizaje en casa. Las familias que prefieren que sus estudiantes de esos grados continúen aprendiendo completamente en casa, en línea, pueden continuar esa opción. La doctora Jill Baker quiere asegurarse que ustedes sepan que ustedes tienen esa opción de escoger si quieren mantener a sus hijos estudiando completamente de casa en línea o también entrar a ese programa híbrido que es mitad del día en la escuela y el otro en la casa. El regreso de los estudiantes de TECA a quinto al aprendizaje en persona supone que la tasa ajustada de casos de COVID en el condado de Los Ángeles va a permanecer bajo del 25 casos por cada 100,000 personas, según lo especificado por las pautas más recientes del Departamento de Salud Pública del Estado de California para la reapertura a todos los empleados del distrito escolar que deseen la vacuna para COVID. Miles de empleados del distrito escolar han recibido estas vacunas en las últimas semanas, con prioridad para los empleados y maestros que trabajan cara a cara con el público en los primeros grados. A los maestros de kinder de transición hasta quinto que regresen a dar clase en persona, se les habrá ofrecido la primera y segunda dosis de la vacuna. Estos maestros regresan a sus clases el 22 de marzo para poder prepararse para el regreso de sus estudiantes a medida que por esa semana continúen los estudiantes estudiando de su casa. Los criterios de salud pública de California son un poco más estrictos para la reapertura de las escuelas secundarias y preparatorias, sexto grado hasta el último año de high school. Los niveles de grado de las escuelas secundarias y preparatorias pueden reabrirse para aprendizaje en persona si el condado permanece en el nivel rojo determinado por el estado durante al menos 5 días. Bajo ese nivel rojo, las tasas de casos promedio de 7 días están entre 4 y 7 casos por cada 100,000 personas y la positividad promedia de las pruebas de 7 días entre 5 y 8%. Suponiendo que el condado de Los Ángeles cumpla con los criterios de salud pública del estado, el aprendizaje en persona para las escuelas secundarias y preparatorias en horarios híbridos comenzará en esta línea de tiempo. Grado 12, último año de preparatoria, empezarían el 19 de abril. Los grados sexto a octavo grado, 6 a 8, empezarían el 20 de abril y grados 9 a 11 empezarían las clases el 26 de abril. Como mencioné anteriormente, la doctora Jill Baker, superintendente del distrito, le respondió a un mensaje de los medios preguntando por qué aquellos de sexto grado no pueden regresar a la escuela el 29 de marzo. Tomamos en cuenta que sí hay escuelas aquí en el distrito que son de K a 8 y esos niños de sexto, séptimo y octavo grado no pueden regresar dado que ellos no están fijos en una clase, sino tienen que moverse de clase a clase para tomar sus cursos. Los maestros de secundaria y preparatoria regresarían a sus clases el 12 de abril para prepararse para el regreso de los estudiantes, como mencioné antes, que empieza el 19 de abril para el grado 12. Aquellos que asisten, mencioné anteriormente, K a 8 solamente van a abrir de kinder a quinto grado. La seguridad de los empleados y estudiantes es la primera prioridad del distrito escolar. Durante el mes de febrero, el distrito escolar está proporcionando actualizaciones e información, incluyendo videos de cómo se van a ver las clases con distanciamiento social, saneamiento y otras medidas de seguridad implementadas. La limpieza profunda, la desinfección y de todas las superficies de las clases se realizarán de forma rutinaria. Y se ha proporcionado capacitación adicional sobre salud y seguridad a los líderes escolares. Los estudiantes que regresen a aprendizaje en persona pasarán por un proceso de evaluación de salud diaria, al igual que el personal de la escuela. Se requerirá que los estudiantes se cubran la cara y los escritorios de los estudiantes estarán separados entre al menos 6 pies. Los estudiantes de primaria permanecerán con su grupo o su propio grupo de estudiantes y personal mientras que están en la escuela en clase para poder minimizar contacto con otros grupos o otros estudiantes y personal. Eso es por seguridad de ellos mismos. Está planeado también las pruebas de COVID de estudiantes y personal. Algo que queremos mencionar es que el Estado no está requiriendo estos exámenes de COVID para aquellos que no tienen síntomas, pero el distrito, para asegurar en el nivel morado que haya seguridad, van a requerir que los estudiantes se tomen un examen de COVID semanalmente mientras que están en el nivel morado. Eso es para cuando empiecen los de primaria. Utilizando muchos de los protocolos de salud y seguridad descritos anteriormente, el distrito en los últimos meses ha brindado con éxito aprendizaje en persona en entornos preescolares y de guardería durante la pandemia, atendiendo a más de 1,600 niños de trabajadores esenciales en los centros de desarrollo infantil y en Kids Club y Head Start. Para más información sobre todo en detalle, puede visitar a la página web lbschools.net/coronavirus. Se lo voy a deletrear. Es lbschools.net/coronavirus, que deletrea coronavirus, para obtener más actualizaciones y el plan de seguridad y reapertura de escuelas para la pandemia de coronavirus del distrito escolar. La superintendente de escuelas, Dr. Joe Baker, terminó dando las gracias a todos que han ayudado para llegar a este punto. Terminamos hoy con Kelly Colopy, la directora de Salud y Servicios Humanos, que en primero habló de la vacuna. Hasta la fecha se han administrado más de 79,000 dosis de vacunas aquí en la ciudad de Long Beach, lo que incluye a las personas que viven o trabajan en la ciudad. Por ejemplo, una maestra que quizás viva fuera de la ciudad de Long Beach, pero trabaja para el distrito escolar de Long Beach, recibiría una vacuna y cuenta en los 79,000. De estos, más de 55,000 son la primera dosis y los 24,000 restantes son segundas dosis que se han administrado. Seguimos dando prioridad a las segundas dosis durante todo el mes de febrero y seguimos reiterando activamente a las personas de VaxLB, para aquellos ustedes que se han ido a la página de VaxLB para registrarse, para poder programar las primeras citas para los trabajadores de salud, los adultos mayores, los educadores y los empleadores del sector alimentario con la vacuna disponible. Esta semana continuaremos comunicándolos con personas para programar más citas para esa segunda dosis. Si fue vacunado por primera vez en enero, ya debería haber recibido usted un correo electrónico con información de cómo hacer su cita para su segunda dosis. Si no ha recibido su cita, por favor comuníquese con el Departamento de Salud en covid19vaccine@longbeach.gov y se deletrea COVID-19 como COVID-19, VCINE@longbeach.gov para que podamos programarlo para su segunda dosis. Si no tiene correo electrónico, por favor no se preocupe, lo podemos asistir llamando al área 562-570-4636. Si fue vacunado por primera vez en febrero, por favor, continúe esperando. Ese número de teléfono es solo para las personas que recibieron su primer dosis en enero. Si la recibió en febrero, continúe esperando para que el Departamento de Salud lo contacte. No hay necesidad de llamar para verificar su estado. Debido al clima severo en la costa este, los fabricantes de vacunas han retrasado el envío de la vacuna hasta nuevo aviso, lo que podría afectar nuestro suministro aquí en Long Beach. Seguimos vacunando a tantas personas como lo permite nuestro suministro, pero como se imaginan, esas vacunas estamos poniendo a las personas lo más pronto posible. Es posible que haya visto que algunas clínicas de vacunas en otras localidades han tenido que cerrar en los últimos días debido a problemas de suministro. Por ahora no estamos ni planeamos cancelar ninguna de nuestras clínicas, pero no estamos programando nuevas clínicas hasta que se establezcan esos envíos de la costa este. Tenemos la esperanza de que esto sea afortunadamente la próxima semana. La ciudad también se compromete a asegurarse de que las vacunas se administren de manera equitativa. Continuamos brindando clínicas móviles de vacunas para las personas en comunidades que han sido más afectados por la pandemia de COVID y para aquellos en vecindarios históricamente desatendidos. La ciudad recientemente realizó clínicas para personas de habla hispana y adultos afroamericanos de 65 años y más para programar clínicas y también ha programado clínicas para la próxima semana para adultos mayores de 65 años en nuestras comunidades camboyanas y latinas. Agradecemos a todas las organizaciones comunitarias que se están asociando con nosotros para poder planificar estas clínicas y seguir conectándonos con nuestras comunidades y especialmente esas comunidades que más lo necesiten. La pandemia está lejos de terminar, pero sentimos que cada vez estamos llegando un poquito más a la luz y ojalá que vayamos viendo los números seguir disminuyendo con la implementación de la vacuna. Queremos recordarle a todos que por favor continúen usando sus cubiertas faciales, manteniendo la distancia física y limitando las reuniones con personas que están fuera de su hogar. Muchas gracias por habernos acompañado. Toda esta información va a estar disponible en la página de web del Departamento de Salud. We thank you for joining us today. If you have joined during our Spanish translation, please see our Facebook page to see from the beginning with Mayor Garcia, Superintendent of LBUSD, Jill Baker, and also our Director of Health Department, Kelly Colopy. We will see you again next week. Gracias por acompañarnos.